Our last session this morning represents Massachusetts General Hospital and the Vaccine and Immunology Center. And I'm going to ask Mark Poznowski, who is Director of the Vaccine and Immunotherapy Center, also Associate Professor at Harvard Medical School and Massachusetts General Hospital, to kind of give you an overview of just what they're working on. Thank you very much, Mark.
Basically, the way to think of the Vaccine and Immunotherapy Center, which we affectionately call VIC, is that it was started 3 years ago on a classic academic path, which is you go into your chief's office and they say, we'd like you to create a center at Massachusetts General, and you think, well, that's a tremendous honor. Set as our mission the goal to accelerate the development of broadly applicable vaccines and immunotherapies. And when broadly applicable is very important to me personally. I work as a physician in infectious diseases with an interface with oncology. My pitch here is to develop therapies and vaccines which are available to the broadest population of people that would otherwise be affected by that disease or would be prevented from having the disease as possible. And it sort of reflects the climate of constraints on the economics of healthcare currently. The second component is the focus was to put our center firmly in the product development area. That's very unusual, believe it or not, for an academic institution, in the sense that we are generally in the discovery wheelhouse. I run a discovery platform sort of lab which generates grants and papers and so forth, and that is what we do. Product development is something completely different, and I'd learnt about it by being involved in founding biotech companies while working within academia. And we wanted to situate what we did in that space of product development. This is not discovery. Now, we all know about that gap, and we know about the problems of the handoff between academia and industry. And we know that that is extraordinarily inefficient. For the amount of innovation, the number of patents that are filed in academia, the number that cross the bridge, it's actually extremely small. And both academia on one hand and industry on the other would like to see that more effectively done. So how do we bridge that gap at VIC? Basically, we have created a system of VIC project management, or by which a industry candidate or a VIC lab invention or other MGH invention, and that there's really no limit to where we could reach out for taking innovations into this, is put through a managed project development process, including the actual refining of a project development plan, which is often completely alien to the academic leading it, to providing the seed funding, which is often not available. There are very few granting agencies who say, we will fund you over the valley of death. I mean, it would seem almost like an impossible task to think of any funding in that area. So we recognize there must be funding. We understand the importance of critical proof of principle experiments, and that you require regulatory advice during this process. Probably the most important thing for us is that the entry point, you're already thinking of the exit, and the timeline for most of these projects is 2 to 3 years to go from an innovation to an exit, where the exit would be an industry licensing point, a clinical trial of that agent, first in human or in a repurposed model, even going to phase 2, and then or a spin-off into small companies. That's our metric of success. And all of those exit criteria are thought about when the project is brought into VIC. So we're looking ahead to that project leaving and working out the right partnerships, the right internal and external players who will facilitate that process.
So right now where we are is we're at about $1.5 million in burn rate a year for the projects that we have in the pipeline and the infrastructure. And as you can see, we highly leverage the philanthropy that comes into VIC to raise additional funding either through grants, contracts, or other development projects that are alongside of that. But obviously, if you think about having, let's say, 6 projects in the pipeline that need to go from the preclinical stage into the clinical study, you can just close your eyes and imagine that $1.5 million is not going to lead there. At the same time, we're a young organization. We've been in existence for 3 years. So I think when you look at the stage of maturity of our organization, we're kind of moving out of the survival stage and into the developmental and scale-up stage. And like the old Philip Wilson joke about, the church going from crawling to walking to run, in order to run, you need money. So we understand that in the future, we really need to go from a burn rate of about $1 to $2 million to something north of $10 million. And the idea is that we're going to continue to draw on grants and contracts, but as Mark mentioned, a lot of our funding is coming in not only for funding of the infrastructure that's necessary, and quite frankly, grants and contracts don't fund a lot of the kind of infrastructure that's needed for project development, but also philanthropists who have a particular interest on a disease, we're able to actually tie them into specific developments of specific product candidates. And so we're really looking to raise that money first to fully fund our management team for the projects, and secondly, to actually move those preclinical projects through their key developmental stages, whether that's preclinical safety and toxicology, manufacturing, some of the other key things that you are all familiar with.